Hi, I'm Matt Toronto, and we're talking about the Emsella chair here with Kathy Toronto. And yes, we are related, but this is a great model for the Emsella chair. The Emsella is a great new technology that utilizes MRI-type energy to cause contractions in all the muscles in the pelvic floor. So its sister product, the Emsculpt, uses that technology to work on the abs, the glutes, the calves, the biceps, and really strengthen and define those muscles. But just as important are the muscles of our pelvic floor. It's part of your core muscle system. And what's really interesting about the Emsella is it is the first device that is FDA cleared for incontinence in women, and urgency in men. And so for women, as they grow older, especially if they've had children, the majority of women will end up with some level of incontinence. It could be very small. Some people it gets fairly significant. And up until now, there just has not been a lot of good treatments for it. There's pelvic floor therapy, there's mesh, nets and webbing surgery that they do, but nothing that has been, wow, this really is good, until Emsella. And I will tell you what's great about this device is it is so easy to use. So we're going to demonstrate this right now with Kathy. She's sitting on this chair, and she sits kind of just in the middle of the chair. The energy is coming from underneath her. And you can actually, she's going to be able to turn this on and do it herself.
Probably easier because I'm sitting right here.
That's right. So the energy is going to focus on the muscles on her pelvic floor. And she is going to feel a fairly dramatic contraction. It's totally involuntarily. She couldn't stop it. It is not painful at all. In fact, most people sit here and they play on their computer, they read a book, they watch TV. It's a 30-minute treatment. But so right now, as you're feeling kind of this ticking, what is that sensation like?
So this is an important part of the treatment because it helps you get situated in the chair. So when you come, you won't be turning on the chair yourself. We'll have a provider in the room taking care of you, of course. But it helps you get into the right spot. So if I'm too far forward in the chair, then it activates my bum, my glute muscles. And so you want to make sure that you're right in the spot where it would activate the pelvic floor. So the ticking just helps you find that spot. And that's the only sensation I feel. It's a ticking.
Yeah, and that's the first part of this. And once she feels right in that center, in the area of her pelvic floor, then she's going to switch it to the main energy, and this is a 28-minute treatment, and it's going to send these pulses of energy causing contractions in the pelvic floor, increasing muscle flow, but really strengthening that muscle. And what happens with incontinence is as our muscles weaken and things drop, they put pressure on the bladder, which causes incontinence. We have a lot of clients that say, I played tennis and I pee my pants a little bit. I laugh, I sneeze, God forbid you do jumping or anything. And it can become a really big issue with having to wear pads and things like that. So this is such a wonderful, non-invasive treatment to address that.
Yeah, I was shocked how many women actually have this problem, at some level, because it's not like women sit around and talk about, oh, I peed my pants. I mean, we just don't talk about that. And since we brought this technology, and also Diva, which those treatments go really well together, or these treatments go really well together, I've talked so openly about it with so many women. It's just been shocking to me how many women deal with it to some degree. So I love that we offer it at AesthetiCare because it gives us a way to really help them, and it makes such a huge impact on their life.
Yeah, I've got a friend of ours who's an avid tennis player, and she said she could not play tennis without wearing pads, and now no pads, no issue. But what's really nice is this was obviously developed for incontinence. But what they've noticed is some other benefits that are great, and most of those relate to sexual health.
Yeah, so I'm just going to jump in.
Okay.
So one of the ways this was explained to me, which I love this, one of our clients had the treatment, and she was just explaining to us and to actually some of our other clients like what it was like. So it wasn't that we went out and asked her, she just was kind of sharing out in the community. And so her explanation was that, in your 20s, you always have this tingle. And in your 30s, you see your husband and you have the tingle. And then in your 40s, a couple weeks could go by and there hasn't been a tingle. And she goes, in your 50s, like you really almost, there's no tingle. And she said that the Emsella brought her tingle back.
I know, good description.
I love it because it really does. I couldn't have put it into words prior to that, but once she kind of once I heard her story, I was like, that's exactly what it did. I mean, it brings blood flow. I mean, it makes perfect sense. Like you're stronger down there, you have more blood flow, it increases lubrication. So of course, it just kind of explained it, brings your tingle back.
Yeah. And the thing is, our bodies age, our whole bodies age, including the pelvic floor for men and women. And so, especially again, women who have gone through childbirth, whether it's 1, 2, 3, multiple childbirths, things change. And to be able to take the vaginal wall, the muscles in there, and tighten them and strengthen them makes a huge difference. What you said, to dramatically increase blood flow, which is so important in everything. So this has really become great. In fact, we work with a really well-known urogynecologist on the East Coast. We've given some talks with him, and he says this device plus Diva, which is vaginal rejuvenation, he said he's never in his career seen anything for sexual health that's that good. That combination is just so good. And again, it's not just for women.
Right, not just for women. And right now, just explain what I'm feeling. So I do feel muscle engagement. And I have it on a lower setting right now just because it gets a little bit louder so that we can hear you talk and we can hear both of us talk. But as it increases and as the sound increases, the intensity increases. But there's never been one client that's come in that said it's painful, that they can't get through it, that you can't get them to the maximum number. So if I go all the way up to the maximum right now, it's a little bit more intense, but it's
not
totally comfortable.
Yeah,
and I think that's always one of the scary things about it. Like, look, I get to stay in my clothes. Although a lot of women come in, we have them, and men, we put them in these like really thin shorts because they're more comfortable to sit in.
Right.
So if you've come in tight jeans, you don't want to sit in tight jeans during the treatment. So we'll give you a pair of shorts to wear. But you sit there in your shirt. You can read a magazine, a book. We have a TV in the room that this is situated in, so you can watch Netflix while you sit here on the chair. It's just a super easy, completely non-invasive type of treatment for vaginal health.
And ideally what we do is we recommend a series initially of 6 treatments, 2 a week for 3 weeks. And then from there, depending on your age or if there was incontinence or things like that, a maintenance program of anywhere from 1 treatment a month to every 2 months, every 3 months, just to keep that engagement, that muscle strength there, because it is a muscle, and if you just stop, eventually we'll go back to where it was.
You want to switch?
Let's do a switch.
Watch this. Okay.
Because it is good for men too.
All right.
Okay, I'm not gonna let her touch the dial because she likes to just shock me and turn it up. But
it's not. Even if you did jump to 100, it's really very doable. So I explained a little bit about women's health and the importance for women and some of the impact it's made on myself as well as my girlfriends. So let's get your ticking going.
Oh, I'm sorry. I gotta hit that. There we go.
There it goes.
So I am feeling the same thing. I'm just feeling this energy in the pelvic floor. It's not painful. It's a little bit odd at first. So you're kind of like, wow, I really feel that. But nothing that you wouldn't do.
And so what have men been saying about it? Why one of the reasons why we purchased this device for our clinic was because a good friend of ours, a man, he's in his 60s, had shared some of his results with us.
Yeah, it was interesting because he is a traveling salesperson and he's getting a little bit older and he has to drive from Kansas City to St. Louis a lot. And he said on average he would stop 3, maybe 4 times to go to the bathroom on that 4.5 hour drive. And after he did a series of 6 of these, he goes, he doesn't stop. He doesn't get up at night to go to the bathroom. So for men, more so than incontinence, even though men can have some incontinence, it's more urgency, that feeling, oh my God, I got to the bathroom. And a lot of people, even my age, for instance, I get up twice at night to go to the bathroom. And obviously it interrupts your sleep. And so by strengthening the pelvic floor, the muscles there, this is something that's going to diminish that. And that can be, especially for people who travel on planes or take long car trips or stuff, to take that out of that equation, it's a heck of a deal.
Definitely. So same number of treatments.
Yep, series of 6 treatments, 2 a week, ideally for 2 weeks. You can do 1 a week, but 2 a week we think does a little bit better job.
And then what about sexual health for men?
So this is an interesting conversation I had, again, with this urogynecologist, who obviously this is his specialty. And a little bit graphic, but so men, to get an erection, it's about blood and muscle. And when a man has an orgasm, it's a muscle contracting that creates that orgasm. Well, as we get older, that muscle is not as strong. And he put it kind of graphically. He said, well, a 21-year-old has an orgasm, it might hit the ceiling. 6-year-old has an orgasm, and it doesn't go very far. And he said, if you strengthen that pelvic floor and get those muscles strengthened, you're going to get more pulses, stronger, just really more dramatic orgasms. And the feedback we've been getting, and this is interesting, we have a married couple, it's a good friend of ours, middle-aged, but she had 3 kids, great people, great marriage, sexually active people, and they went through a series, and she did the Diva and the Emsella, and he did the Emsella, and they wrote us the nicest testimonial, and they literally said, this is amazing. It has just taken our sex life to a new level. and we feel like we're in our early 20s again. And that's pretty powerful to be able to do that with no medication,
Right.
no downtime, nothing invasive. It's a great deal.
It's the easiest treatment,
Yeah.
and the benefits are unbelievable.
Yeah,
So.
and again, some people are worried, obviously surgery, there's a lot of worries there, or invasive things, but the fact that you can sit here and there's
Have a
nothing going in your
conversation.
body, have a conversation, and knowing there's no chemicals going in your body, there's nothing, it's all natural, it is literally strengthening your muscle, increasing blood flow. So it's pretty simple, it's just the technology is very advanced.
We actually do have a lot of couples that come in and do it because, especially when you look at sexual health, then it makes sense for both the male and both people to come in and have the treatment.
Well, and I think in this day and age, it's becoming more common to hear about it, at least. I mean, come on, if you are watching ESPN or any of these, you can't see 5 minutes of television without an ED drug, a Cialis or a Viagra being advertised. And then a lot of companies have come out with their vaginal rejuvenation. So you're getting a lot of family practice, internal medicine, OBGYNs, urogynecologists talking more about what you can do for sexual health.
I think men talk about it a lot more than women. I mean, you talk about sports radio and ESPN. I mean, that's where you hear all of those. Like if I go to the typical women's female stations, they don't talk about a lot of it. I think for men, it's one of those things that out of all the things that we do in AesthetiCare, men would probably talk about more than women.
Without a doubt.
And so I think it's a really important topic. It's something that affects our daily life, and so it's one of those things and reasons why we really want to get the information out there that there is something that you can do.
Yeah. And if you have any questions, call in, make an appointment for a consultation. Again, what we recommend is a series of 6 treatments to start and then maintenance as you go along. But if there's any issues with incontinence, maybe sexual performance is down, urgency for men, I'm telling you, there's not much better you can do than this Emsella treatment.